I'm Dr. Frank Lotika. I'm qualified a doctor for the past 30 years and as a specialist family physician since 10 years ago. Managing patients with a holistic approach to take care of their feelings, fears, ideas about their problems. That was the main reason for me to become a doctor. I've learned a lot today, especially in terms of skin care. We do have a lot of patients in Queensland, even in our area, with skin problems. With what I've learned, when it comes to the suturing methods, and even when we have to look at better results from the suturing, from the care even itself, I think it will have a very good impact on the outcome of our patient. Yes, I will recommend this course to everyone. I'm really excited, and then yes, I'm really excited with what I've learned, and I will recommend it to anyone who is involved when it comes to suturing and skin care of any patient in Australia, even all over the earth. When we have to diagnose a patient with skin cancer, it is quite a challenge. And for that one, we need specific techniques, how to use the demoscope, and know exactly whether we are dealing with a benign or suspicious tumor. This is very important. Yeah, I think opportunities we can get through like workshop like the one that we have attended this morning. Yeah, because the GP or any doctor, we must keep on learning, because if you don't learn, we can't get anything for our patients. Yeah, to start with our team, there are things that I'm gonna implement in our practice. It will be part of our, I can put it like guidelines, policy that we are gonna implement from, in our practice from today. Yeah, the greatest experience that I've had, it's the report that I got from a patient from our community. They put it on Facebook. More than 100 patients commented, spoke about what we are doing in our practice. It makes us feel proud of what we are rendering in the community. The valuable lesson that I've learned is to consider any patient as a human being. When you consider a patient as a human being, you will treat him with respect and with better care. The most enjoyable thing that I like since I've been doctor is when a patient can come and tell me, "Thank you, Dr. Frank, for what you have done."